I'm going to talk to you today about Alzheimer's Association trial match, and I'm going to do a brief overview. And this is a nice dovetail, as Dr. Ekstrom was saying, off of Dr. Quinn's comments about clinical trials. And this is somewhat of an other database to use in addition to clinicaltrials.gov. One of the differences being that trial match, the database, strives to include only studies that are actively recruiting participants. And in the presentation today, you're going to see a number of screenshots walking you through the actual website and a couple notes about some of the screenshots you'll see. All of them are accessible to those that identify as a physician or researcher prior to accessing the database. And physicians and researchers can access all clinical trials information in there without actually creating a profile. A couple of the slides you'll see refer to View All Trials, and that's an option that is not available to anyone that identifies as a patient, caregiver, or a healthy volunteer. But any of those individuals that create a profile can then log on to the system and match with a study that is seeking their profile criteria. So I can tell you from personal experience, this is a very easy system to use. I've created a profile on there and it's free and it doesn't take much time at all. A note about some of the language you might see, clinical trials versus studies. Clinical trials refer to controlled scientific studies exploring the experimental use of a pharmaceutical agent like a drug on consenting humans, whereas a study includes clinical trials as well as other protocols evaluating interventions, including non-pharmacological interventions. Two easy ways to access Trial Match. You can go onto the website, alz.org/trialmatch, or if someone's more comfortable actually speaking with a live person, they can call our 24-hour helpline and speak with a Trial Match specialist. So we have staff, they're based out of our office in Chicago, and all they do is trial match information, answering questions, and getting people set up in the system. So we're going to start by going through what it looks like when a physician or researcher wants to access the database. And you'll see this is exactly what it looks like when you go to the website, and you can easily pick from a drop-down menu what user type you identify as. And another thing to keep in mind if people are thinking, well, I'll try one of the other users and enroll in that way, the information and language that's included is specific to user type. So someone identifying as a physician or researcher is going to have more complex trial information in there than would be included for a lay individual. So you'll see once you go to the next screen, you have the option to view all trials. This is also where you could create a profile, and anyone can because we do need healthy volunteers, hint, hint. But you don't have to. You can simply view all trials and see all of the information available. So you'll see once you get into the viewing all the trials, you have a couple of options to search through what's available in the database. You'll see at the top there's the advanced custom search, and you can search for a variety of factors: city, name of the drug, disease. You can search also by phase of the clinical trial. And as some of you may know, but some of you might not, clinical trials are divided into 4 phases. Phase 1 tends to be much smaller populations, looking at that first experimental use of a drug, looking at side effects, safety, and dosage ranges. Phase 2 clinical trials look at further evaluation of safety, but also looking at the efficacy of the drug, and you're looking at a larger population. Phase 3 clinical trials are looking at a further larger population, as well as looking at comparison possibly to other drugs that are treating similar diseases. And then phase 4 is that post-market studies where we're looking at optimal use and risks and things that have happened once they've been put out into the public. You can also quick sort by category, and I see it's pretty hard to read there, but some of the categories are treatment, diagnosis, caregiver, and other. So like I mentioned, there's non-pharmacological studies going on, and that information would be included in there as well. And then you also have the option to just scroll through the studies, and there's links that provide more information about the protocols and details about the studies going on. So it's really comprehensive, and you can really get a lot of information just by browsing through. I'm now going to walk you through what it looks like for someone to actually create a profile and try and match with studies. And again, you have to actually create a profile and complete all of that information to see what you might match for. And again, just a reminder that the information is going to be written for the user type identified. So something that I like about this, and I think that is a comfort for people using the system, is that it's an anonymous account. You don't have to use your name. It is all confidential, secure. And you'll see that it does ask for an email address, but that is only accessed if someone is seeking further information. So beyond that purpose, they will not be receiving anything and their information will not be shared. To further ensure confidentiality, a user can actually create their own username. So they don't even have to use their name. They can make it whatever they want to give them a little more comfort as far as exploring the system and sharing their information. Because as you'll see on the next slide, you do have to fill out a profile questionnaire. And it does ask for a variety of medical information, particularly for someone with the disease or a healthy volunteer or a caregiver, that people might not want their name associated with that. So knowing that it is confidential. And of course, again, going back to information being targeted at the user type, a physician or researcher, their profile questionnaire is going to be targeted at them and have much more complex healthcare related information. Whereas for other individuals, it's lay medical terms and information that they would know about their own medical history. And we're going to look at some of the criteria that are part of the profile. So you'll see some very basic information. This is used to match inclusion and exclusion criteria as far as for clinical trials. So you'll see the bottom there, devices are mentioned. People might wonder, why does that matter? Well, if a trial is looking to use imaging studies, the presence of certain devices might exclude someone from the study simply because the imaging can't be done. And once you have completed your profile, you will then see what studies you've matched to. Personally, I can say when I did it, registering as a healthy volunteer, the first time I put a search in, and the closest clinical trial was in Arizona. I looked actually a couple months ago, and we've moved up to California. So we're getting closer and closer for the healthy volunteers for my specific profile. Now, other information, if it changes, that will change what information, as far as profiles and matches, that would be there. And so a nice thing about the system is that by having a profile in there, you can go in and update it whenever something changes. So say medications change, your health status changes, you go in, you update that information, and then you can see, well, now maybe there are clinical trials going on near you that you qualify for. The other nice thing is that you can search by zip code or by radius. So by making it unlimited, like I did, I found studies all over the country. You can search very nearby if you are limited by transportation issues or getting around, and see what's nearby for you to use. So what next? You now decide you want more information. How do you go about doing that? There's 3 very easy ways to get more information about this, and it can even be something that a clinician walks through with their patient to help them with the system. You can click and actually just have a trial match specialist contact you. So by doing that, they will follow up with you within 1 business day. One thing to keep in mind about this, because they are based out of Chicago, they are on Central Time. And they work 7 to 7 Central Time. But again, there is an option to leave a message, and they will call you back. You can simply call the helpline number directly, that 1-800-272-3900, and you can ask to speak to a trial match specialist. Like I mentioned, we have staff dedicated solely to this program. And then the other option is to send an email, and again, someone will follow up with you that way. So it really is user-friendly, makes it easy for people to reach out to the program, see what's out there. Even if they don't necessarily want to enroll, they can just see what might be there and available for them, and to know what's going on all across the country as well as locally. So we certainly encourage people to enroll in this. As Dr. Quinn was talking about, we know that we need more and more people to enroll in clinical trials. This is the only way we're going to be able to move forward in finding a cure and finding more treatments and better treatments for individuals. And you'll see these various numbers up here. The Trial Match program was launched in June 2010. So in the first 10 months, a lot of web traffic, a lot of people completing profiles. Additionally, since it's been developed, there's been a little over 4,000 people that have gone back in to update their information and see if they further qualify for any additional trials. But you'll notice that those numbers get smaller and smaller. And the reason for that is what we call the funnel effect in clinical trial recruitment. that as people go through various steps of trying to enroll and get more information, there's drop-off. Maybe they don't decide not to enroll. They've gotten more information and they don't want to be included in this. And so less and less people get involved in it, and that's why we need more potential candidates to enroll and see what they might match for. And as we've heard, we know there are studies going on all over the country. There's new ones being added all the time. We hear about ones coming up. So we encourage people to utilize this as a recurring resource. This isn't a one-time thing that you do and then you leave it alone. You can check back in because you never know when there might be something else for you that's a good match based on your profile. Again, a very easy service to use. This is just a brief overview of what that service looks like. But it is easy for you to use, it's easy for patients to use, and there is always the option of calling and speaking with a live person, which we know some people just prefer that, and that's okay, but we have the staff to do that. And so, that is a note on trial match.
Thank you, Pamela.
Yes.
Do you have a minute for question?
Yes, we have a minute
Okay.
for question.
Let's see. Oh, yes. I wonder if you could just speak a little bit about a healthy volunteer who volunteers. Dr. Quinn made reference to borderline people, and then they could see if the disease progressed or not. How would a healthy volunteer be used? Would we wait until you died and your brain was examined? Or I'm just trying to think, because you mentioned this huge drop-off, and I'm wondering, there must be something in there that at some point scares off people. So what is it? That's why I'm going right to there. And also, if you could just say a little bit about how healthy volunteers are actually used, if they go all the way through and
Sure. I think in general it would depend on the study. If there are studies that are seeking healthy volunteers, undiagnosed individuals, looking at people maybe that don't have a diagnosis but have a family history of Alzheimer's. They may be recruiting from that population. And it really, I think, is study dependent. So, I mean, that's kind of the best I can say as far as why they seek
Why
help.
do so many people drop off?
Why do so many people drop? It's a variety of reasons. They might think they're a good match, and then they call and speak with a trial match specialist, and they get more information and realize, you know what, maybe this isn't a good fit for me. I don't want to make the commitment to being enrolled in a clinical trial, which for some people requires, depending on the study, there might be very frequent monitoring where you have to go into a clinic every few weeks to get testing. And for some people that might be a turnoff and they just can't really manage that sort of commitment. So they might not get involved, or something in their status might change. They might think they're going to enroll in the trial and then something changes with their health and they no longer qualify or meet the criteria they're looking for. So I think there's a number of options as far as why people might drop off.
One more
You want
question.
it? Yeah.
Oh, yeah, please.
I just want to emphasize,
Yeah.
sometimes people do decide that the trials are not for them when they hear the details, but more often it's that there's some rule about trial participation that they don't fit. So a lot of the studies, your mini mental state exam score has to be between, let's say, 14 and 26, and people might be outside that window. Some studies require an MRI, and if you have a pacemaker, you can't have an MRI. Some studies, you're not allowed to be on insulin, you're not allowed to be on... So there is this funnel, as you were describing, but it's not, I don't want to give you, it's not people getting scared away. It's very often that there are just criteria that people don't meet, and that's why they don't make it.
And I think that's part of why with that profile, why a lot of those questions go into, you saw some very detailed information because of that specific criteria that one medication or one health condition might disqualify someone.
Yeah, thanks for the clarification, Dr. Quinn. Let's have one more question.
Do you ever go to like retirement centers or to recruit patients like in a group, and then to make it easier for them, do you take the care to them? So you would, you know, do an assisted living, for example, and then have a day when everyone gets their blood drawn, etc.
We don't do things like that, but that's certainly an interesting suggestion.
I actually have a question for you too, and maybe just because I couldn't see the screen as
Yeah,
well.
sure.
You mentioned physicians and researchers,
Mhm.
but if I'm, for example, a social worker at an assisted living or at a long-term care facility, would I, and I'm thinking about, you know, somebody in my facility who's interested in being in a trial or something like that, would I punch the button that says physician or researcher, or would I be trying to do it individually with that client to do their user profile as a patient?
Sure. To get the best match would be to create a profile for your client. So like I mentioned, walking someone through the process, maybe having them there, making the phone call to a trial match specialist so you can help answer some of those questions and facilitate the conversation. I mean, certainly if you just want to get a sense of what clinical trials are going on in the area, you can identify as a physician or researcher, click view all trials and see maybe there aren't even any trials going on nearby, so it wouldn't be an option. But you create the profile so it's in there, and then you can update it and check back and see what progress has been made.
Can you create 2 profiles?
Yes, you can create more than one. And they're all saved in the system, so everything is in there, and you can just continue to log in, and the account holder is the only one that can actually access it.
So don't forget that you have 2 different usernames.
Yeah.
All right, well, thank you very
Yeah.
much, Pam.